Namaste to everyone. This is Dr. Praveen here. I have a upper GI endoscopy with me. So today we are going to look into the what are the indications of upper GI endoscopy. So first of all, most of the people get afraid because it's minimally invasive. So first of all, I can say that the diameter of this upper GI endoscopy is hardly 9 mm and which has to be put in the food pipe, and diameter of the food pipe is 2 centimeter, that is 20 mm. So this is 9 mm and that is the 20 mm. So it can go into the food pipe without touching it. So only things where it touches is the larynx, that is in the neck. So once the patient deglute it properly, and once it the is under means is get admitted into the GI tract, gastrointestinal tract, then it won't hurt much. The only at the in the neck. So if the patient cooperate properly, even there also it enters without much difficulty. That will take hardly 3 seconds to 4 seconds. So that's about the fairness of upper GI endoscopy. So coming to the indications, where at all is indicated. So you may be seeing this video because your doctor might have advised you to undergo the upper GI endoscopy, or else if you wanted to know more about the endoscopy. So we'll discuss about the indications of upper GI endoscopy. So this procedure is indicated to diagnose the diseases, for the surveillance of the diseases, for the screening of the diseases, and for to treat the disease, that is therapeutic procedures. First, we look into the where at all it is indicated for to diagnose the disease. The first one is dysphagia, which means difficulty in swallowing. To know is there any foreign body stuck in, whether is there any growth which is maybe benign or the malignant, cancer or non-cancerous growth in the food pipe or else in the stomach. So to know that, so we are going to perform the upper GI endoscopy. The next one is dyspepsia, any discomfortness in the upper abdomen which can't be ruled out by using the ultrasonography and clinical findings. Then your doctor may indicate to undergo upper GI endoscopy procedures. Next to that, vomiting or hematemesis, vomiting without any cause, where we couldn't able to trace the cause by other clinical examination and other investigations. Then also for repeated vomiting, your doctor may indicate upper GI endoscopy. And hematemesis, that is vomiting of blood. So like varices bleeding, ulcerative ulcer bleeding, or else the severe gastritis bleeding. So that has to be ruled out only by the upper GI endoscopy. Next comes atypical chest pain. The patient may complain pain in the chest, particularly on the towards the left side, and that may radiate into the neck or the for this left side of the arm. Because esophagus is not exactly in the center of the body, it's slightly deviated towards the left. Hence, it mimics like the pain as that of the cardiac pain, pain as that of the pulmonary pain. Once the cardiac issue and pulmonary issues are ruled out by other investigations, and in spite of that also the patient is complaining of pain, then they will consider prescribing the upper GI endoscopy to rule out the esophageal pathologies. And if the patient is losing the weight without any specific cause, then also the patient has to undergo upper GI endoscopy to rule out the cause of upper GI involvement in the weight loss. And this is like celiac diseases like intolerance to the glutamines like wheat, milk, etc. So where we can see an duodenal villus atrophy. So in those conditions also the upper GI endoscopy is advised. And patient having diarrhea. So diarrhea is lower GI related, then why they are advising the upper GI? Sometimes even the lower GI pathology, which may reflect in the upper GI also, like Crohn's disease and all. So there also, to know the extent of the diseases, patient requires upper GI endoscopy. Next to that, if apart from GI symptoms, even sometimes the respiratory symptoms like chronic cough, repeated chest infections, where the having of achalasia cardia and the huge hiatus hernias are suspected for the cough and repeated chest infections, there also a doctor indicate the upper GI endoscopy. These are the few, and gastroesophageal reflux disorders. So these are the few indications for diagnostic endoscopy. Coming to the surveillance endoscopy, that is if the patient is known case of some diseases like Barrett's esophagus, hiatus hernia, and the esophageal varices. To know the progress of the disease, so patient has to undergo repeated endoscopy at the interval of 6 months, 3 months, depending on the condition. In case of Barrett's esophagus, if it is a low grade dysplasia, then on every 6 months he has to undergo the endoscopy. If it is a high grade dysplasia, then he has to undergo every 3 months, uh, and in case of varices, esophageal varices, he has to undergo every 3 months till it get treated. Coming to the screening endoscopy, if there any patients having history of CA esophagus, CA stomach in their first degree relatives, then also he has to undergo upper GI endoscopy on every 10 years just for screening. And coming to a therapeutic has a huge indications. Nowadays, even appendicectomy can be done by using the endoscopes. So, dilatation of the esophagus in the esophageal stricture, banding of the varices in case of esophageal varices, small cancers can be resected submucosally in the CA stomach and all. And this one treating of the Barrett's esophagus and the resection of the submucosal resection and polypectomy. So many huge indications we have. Even by using the endoscope, they can repair even the hiatus hernia. So this is a huge indication for the therapeutic procedures. So these are the few indications for the upper GI endoscopy. If you still have any doubt, then please write in the comment box and let me answer for that. If you have enjoyed the video, then kindly subscribe to the channel and press the bell icon and forward to the needed people. Thanks for watching my video.